I think one of the most important takeaways from today's roundtable discussion was the moral imperatives that everyone has for thinking about health equity and advocating for it and integrating it into your life.
The key thing is for us to think globally and act locally.
The energy in the room was very high, and I think when I looked out through the audience, it was a captive audience.
So it's clear the social determinants of health really play a key part of driving health inequality right from day one. So where you're born, the community you grow up in, the education, social status, environment, all play a key part in driving health inequality from the start.
I think it was Akin that said, there is no right without responsibility. And I feel that is so apt, because if you understand the issues, you can then figure out the solutions for them.
We had a great roundtable discussion today about advancing health equity, and a lot of important messages came through. One of the things that I found inspiring and hopeful is that there are a lot of solutions, and there are a lot of people who really care about advancing health equity and who want to work together to find solutions, to share solutions, to help everybody around the world live their best and healthiest lives.
Could the panelists provide one tangible thing each of us might do to help advance health equity in our own communities?
When advancing health equity, the main thing I would take away from today's discussion is that everybody is responsible. Everybody's responsible by putting their brick in to understanding what's happening in their communities and using a global approach.
The most important thing to have in mind when we are trying to reduce the gap on health equities are involving many of the key actors, the academia, the communities, and also the agencies and NGOs.
A key tip for those who want to advance health equity in their own community is to be as actively engaged within that community as they can.
So we need to be very upright in things we do, rights and responsibilities. Responsibility by every one of us.
And I hope that we left everyone with the impression that they can be a part of the change we're trying to create.
Absolutely.
So the commitment we have with Springer Nature and Takeda is really about elevating, educating, and empowering the world to understand and address health inequities.
It's really important that an organization like Springer Nature gets involved with an organization like Takeda. We are the voice of the scientific community. We're able to advance stories and get it out to our audiences. In terms of Takeda, Takeda has been doing this kind of thing for over 240 years, really trying to help the audiences, making these audiences enable them to have the drugs that they need for their various different ailments.
Partnerships are what are really going to make a difference for us in trying to address these challenges. For us at Springer Nature, working with a partner like Takeda means that we've got an opportunity to do things that we might not be able to do by ourselves.
I think the main takeaway is to identify that each of us has a very integral part in what is considered sort of a structural and systemic issue of health equity.
In this small way, we hope we're going to be able to impact change by identifying solutions and bringing more awareness to this challenge.
So my key takeaway from today is that health equity isn't a project with a specific end date or a specific budget. It's about how we can build an approach that everyone can embed into their everyday practices.
I emerged from today very optimistic. I am further convinced of the amazing, far-reaching power we have in partnership with Springer Nature and Takeda.